Mental health crisis among youth is now the focus of a new research program called CHAAMP, or Child and Adolescent Anxiety and Mood Disorders Program.
The Foundation of Hope started the $5 million campaign in partnership with UNC's Department of Psychiatry. As WREL's Ken Smith explains, the mission is to save lives.
Luke was my wild child. He was hilarious.
Terry Barber's son Luke was diagnosed with ADHD in second grade.
They said, yes, he's got, ADHD, but do you also realize that his anxiety's through the roof? We never saw it. We didn't think it was a big deal, really.
Luke was one of a rising number of children and teens facing anxiety and mood disorders. His struggles ended with him taking his own life.
Every week at the Foundation of Hope office, we receive phone calls from parents who are absolutely desperate to find help for their children.
Shelley Urbelk, executive director of the Foundation of Hope, is part of the same family behind the annual Thad and Alice Ure Walk for Hope. Now they have added the CHAAMP research program with the help of UNC Psychiatry. They hope to curb the rising tide of tragic deaths among youth.
And over the course of the pandemic, according to the CDC, the prevalence has increased 3 to 4 times.
UNC's Samantha Meltzer-Brody says families living in rural parts of the state are less likely to receive expert help. A new strategy is needed.
So telemedicine, telehealth, virtual care is uniquely suited to the delivery of mental health and behavioral health, and that's allowing us to reach people across great distances.
Donations help advance new research to help children at risk.
Bring them into schools, into communities, into pediatric primary care offices.
Clinical psychologist Dr. Danielle Rubinoff says parents play a vital role.
Planning, regular meal times with your child, regular time that you're just spending one-on-one.
Strong, healthy families and saving children's lives. That's the goal.
If we can get ahead of this, if we can use our talents and find the research and develop the research, we can really turn the tide.
Ken Smith, WREL News.
Now, the 35th annual Walk for Hope will take place October 8th. In 39 years, it's funded over $8.4 million in research grants and has gone on to leverage $231 million in further funding.